So as we talk about that, our broad testing goals. Anybody who's symptomatic or who's had a close contact, who's been referred by public health to seek testing, or a clinician deems that they need to be tested. We talked about 2 to 4% of the population a month per district. We want to make sure that's not just statewide, but every district. So we're looking across the Commonwealth for disease. That's between 6,000 to 13,000 tests per day. Making sure that we're less than 10% positivity for each region, and over-testing those high-risk populations. So we've talked about this before, the socioeconomically disadvantaged, people with chronic illnesses, the elderly, people in congregate settings. We're in the process of doing point prevalence surveys in long-term care facilities. We're working with the nursing homes and assisted living, getting those point prevalence surveys done. We've also been testing in prisons and jails and behavioral health. We continue to do, there are over 400 outbreaks in the state that we do outbreak testing and containment. Our containment efforts are much more aggressive and fast now because we've got access to that testing, so we can very quickly identify that. And then overall containment through contact tracing. And then I always say we try and also be very good stewards of all of our funds and make sure when appropriate, insurance that should cover that test for a clinical need, and that the HHS portal for the uninsured, that we're using those whenever possible. Next slide. So what does that look like going forward? This is based on the UVA models. We anticipate in May, and we did far exceed the number of tests that we needed to do per month, 30,000 per month. You look at that, then you say, okay, if we've got that many cases, then how many contacts do we think we might have? How many public health coordinated tests do we do? What's our testing goal? So you can see for May, that was 6,500. We were significantly over that. In June through August, that's going to be around 10,000. September to December, around 11,000. This is based on the current UVA model. But as I said, we looked at the one lab concept. We looked at what was the worst possible scenario, which we're not predicting now, to make sure we had that lab capacity if we need it.